Hi, my name is Olatokunbo Akinde, and this I am going to be talking about the pharmacological treatment for the disease known as OCD, which is the obsessive compulsory disorder in patients. OCD in patients is often difficult to diagnose, and it's also often difficult to treat. And this is because of the attitude of this specific population of patients about taking medication. Um, um, this population, they are usually very suspicious and they are not trustworthy of people, and because of that they do not like to take medication from anybody because they do not trust them. And also they always like to be in control, and the fact that they have to take medication means they are losing their control to somebody else, and they do not like this. So it's very difficult to treat OCD in patients. However, OCD in patients can be treated with the use of SRIs. SRIs is known as the serotonin reuptake inhibitors, and this is considered the first time that they're considered the first treatment for patients with OCDs. And they were actually introduced in the late 1980s and the early 1990s for the use of depression, but eventually they started being used for OCD in patients, and they seem to be working efficiently. Examples of SRIs include Prozac, also known as fluoxetine, Paxil, Lufox, Zolox, Cilaxa, clomipramine. All these are examples of SRIs, and they've shown to be effective in treating OCDs. SRIs quickly became the first choice of medicational treatment in OCD because of their efficacy, their tolerability, and the fact that they've been safe. They have less side effects on people. And how this medication is taken is that it started with a low dosage in individuals, and then gradually the dosage is increased along the way, depending on how efficient the dosage is working on the patient in question. If, however, it is noticed that the symptoms of OCD is reduced in a patient, then the dosage can be reduced. But if it's seen that it's not so effective, then gradually the dosage can be increased to depending on the patient and the age of the patient. However, certain side effects have been seen to occur in people that use OCDs, and this could be seen in form of gastrointestinal disturbance. However, this is actually common in all people that are using SRI medications because gradually, within the first 2 days or 3 days, the patients notice that they have gastrointestinal disturbance, and then it subsides after 2 or 3 days using as long as you keep using the medication. And it has also been said and noticed that hyperactivity is also one of the side effect of using SRIs. So the patient has to be pre-warned that they're going to like notice a lot of hyperactivity after using the medication for like the first 2 3 days. But this also subsides after usage or after the first 2 or 3 days. However, there are certain side effects of SRIs that continue throughout the duration of the use of the medication, and this includes sexual difficulties. This can be seen in form of loss of libido, that is loss of interest in having sex, and then there's also like the weak organism, like they don't produce men, they don't produce enough sperm, or vice versa, and these sometimes causes the use or causes a patient to stop using the medication. So there's also the effect of sedation, there's also the effect of weight gain, and also insomnia in certain patients. So these are some of the side effects which should be watched out for when using SRI medication to treat OCDs. Also, another side effect that could occur is when SRIs are used in combination with other medication. This could actually cause serotonin syndrome in patients. So patients are warned to look out for this side effect. Aside from SRIs that are used to treat OCDs, there are also other medications used to treat OCDs. And these examples of these are nefazodone, trazodone, valproate, and all these medications also have like similar side effects with the SRIs, which is like the weight gain, the loss of arousal. You have sexual difficulties and insomnia in some patients. As as a social worker treating a patient with OCD, or who is with a patient with OCD, whether elderly or not elderly, my job is to make sure that I have enough knowledge about the medication they're taking. I know the type of medication they're taking. I know what side effects it can have on them, depending on what their age group is, and what class of medication they are taking, whether it's SRI or other form of medication. And also my main job is to also educate my patient in regards to what the outcome of the medication is. I should educate them in not expecting that medication is going to cure the OCD instantly. I should educate them not to expect that medication will work as a magic, and to set a kind of boundary for them, realistic boundary for them of what to expect. Also, I should be able to notice whatever side effect medication is having on my clients, to be able to refer them back to the prescriber of the medication. Also, certain drugs, some patients have fear of medication because of the size, the size, the color, or they just have fear of using medication. I should be able to talk to my patient about that. I should be able to observe that in my patient, and then be able to talk to them about what to expect from the medication. As a social worker as well, I have to understand that a person with OCD might be afraid of having a routine, and using medication usually falls under having a particular routine. So I should be able to help my patient with following this routine, and letting my patient understand that the drug use is to help my patient recover from the OCD which is going through. Also, as a social worker, understanding how OCD works in human beings is also very important. Understanding if it's generic, or if it's something that was picked up whilst the patient was growing up, is also very important, to be able to help the patient to deal with the OCD, and to also help the patient in using the medication that was prescribed. Also, where I have a question, I should be able to follow up with the prescriber of the medication as to what kind of side effects to expect from the medication, and also if the side effects I'm noticing in the patient is not as a result of the medication or not. So as a social worker, I have to be extremely knowledgeable about OCD and the medications that are used to be that are used to treat OCDs. And I should also understand what medication my patient is using, so as to be able to help my patient to deal with the OCD that is facing. Thank you.